Hey, my name is El-Adle. I'm very passionate about psychiatry, and I think that has many applications. I think it permeates everything that we say and everything that we do. But I once heard a student ask, "Okay, what if we encounter a patient who doesn't believe in psychiatry?" And I was like, "Okay, can I demonstrate the merits of psychiatry, not only to this student but to this, future patients who may not believe that psychiatry can be useful for them?" So in this video, I just wanted to give a brief overview of some ideas and some concepts that we'll be talking about relating to thought processes and how the thought process portion of the mental status exam can be used to better understand USMLE style questions. Okay, so this is going to be a basic overview video about the thought processes involved in USMLE style questions. And there's going to be subsequent videos further explaining each one of these thought processes. And they will also have a partner video with some actual examples from the sample test questions that are released by the USMLE. And notably, they're for public release. So hopefully we're not stepping on anyone's toes or making anyone upset, right? But to start off with, we have the linear thought process. And the way I think about this prototypically is the constellation of symptoms. So you have 1, 2, 3 symptoms like fever, nuchal rigidity, and purpura. And question writers will give you these, and they want you to connect these and recognize that, oh, this is the constellation of symptoms that leads you towards or clues you towards meningitis. And then you have the circumstantial thought process. And this is a spectrum of either disease or a spectrum of management. And on one axis, you can have something like time, and then they will ask you basically where are we in terms of management based on where we are in time. And this can be on either this axis or it can be on this axis. So you can go through a logical progression of A, B, C, D, and E, or you can simply have to know based on where we are based on time. Next up, we have the tangential thought process. And I think this is one of the most powerful visual representations of a differential diagnosis. Okay, so understanding that, okay, we have a problem list, and if we put fever on one line and nuchal rigidity and purpura, all of these, where is the intersection that causes all of these things? And that would, where do all of these things intersect? And that would be meningitis, right? But there are other things that could cause a fever, and this is how we can produce a differential diagnosis. Next up, we have loose associations, and the way I prototypically think about these questions are sequelae questions. So the clinical presentation will be about something in this red circle, number 3, and then they may ask you, okay, how did we get to number 3? Did we go through 1, 2, 3? Did we go through a different, step, disease process? And then they may ask you, how did we get here? Or they may ask you about, something that's coming up or something that happened previously. Closely related to that, but not exactly the same, is going to be flight of ideas or flight. And the way I think about these are prototypically risk or prevention questions. So you can also think about an actual flight. So if you're on one island and you're moving to another island, these things, although not directly related, are related. And the example that I'll give in the future videos, and again, I'll talk about all these later in more detail, but if you have HIV doesn't directly cause any sort of infection, but it certainly predisposes you towards infections. So what kind of infections does it predispose you towards, and how can you prophylactically treat those types of patients? These are these types of questions, right? Next up, we have word salad. And the way I understand these questions is if you have labs, if you have imaging, or if you have arrow questions, really they don't give you that this is important or that this is what you need to look at, but they'll give you something and then they want you to make the connection between them, right? So they'll give you a point over here, they'll give you a point over here, they'll give you a point over here, they'll give you some lab values, they'll give you some imaging, right? It's up to you to understand how to look at the image and be like, okay, this is, what's going on. These are supposed to be ribs, by the way. But like, okay, what's going on in the lungs, right? Or what's going on with, different types of shock, what's going on with different types of, they give you CSF and talk about meningitis again, right? Next up, we have the derailment type of questions. Prototypically, these are medication side effects in which the chief complaint or the chief concern or the first line of the presentation is going to lead you down a certain, like you're going to think it's going to be going one way, but then the end of the question is going to be, it's very different than how you expected the question to be asked. And so these questions really they're almost two different questions, and you need to be aware that sometimes, a lot of times actually, question writers in the USMLE try to give you these types of questions. Very different from that is the clanging thought process, and this is almost something that you need to keep in. This doesn't really show up much on exams, but it's very important outside of examinations. So for preparation, also on the actual wards, when you're trying to understand what it is that you need to do for a patient. So, for instance, the cephalosporins, we group them together and recognize, okay, this is first, second, third, right? Like these are all generations of cephalosporins, and they're all beta lactams, and they all work in a similar way. But you know, some of these target gram positives, gram negatives. Some of these cross a broad blood-brain barrier. Some of these are broad spectrum, and they cover for Pseudomonas and MRSA, right? And these all have different things. But when you're typing them into electronic health record, right? CEF, you need to understand the rest of the word, and you need to keep these distinct in your own mind. Next up, we have what I call the indirect presentation. And again, I'll talk about, you know, in psychiatry, we say punning or riddles. I don't really like these phrases because they have a certain implication that is not necessarily what we want to talk about, especially when you think about the prototypical example of what is given in the USMLE, which is, you know, elder abuse or child abuse, where you need to tease out something you need to read between the lines, essentially, to tease out what's going on with the patient. So that's why I prefer the phrasing indirect presentation. And then finally, we have the neologism. And this literally means like a new word or a new concept, right? But what this usually presents on as in exams is they'll give you an article, or they'll give you some graphs, or they'll give you some values, and then you need to apply these things to some certain questions that they'll give you, right? So this is almost like a first layer question, second layer question, and the third layer will be the actual question. So you need to understand a lot in order to answer these questions, not to mention that there's a few questions that you should answer using them. And again, there will be subsequent videos talking about each one of these things in detail, and then we'll also have some examples of what's actually going on using live examples and live questions from previous exams.